We are now going to look at tab 7, the vital signs tab. To add a set of vital signs, click the vital signs tab, vital signs, and click add. The time again will automatically default to your on-scene time. So usually when I'm doing vitals, I click now, so it populates that up. PTA wants to know if it was taken before you got there. Who performed the vital signs, or who took the vital signs? Put me down. Patient position when the vital signs were obtained. GCS qualifier, if there's a reason it might not be below, or might be below 13. Initial GCS values without intervention is what you're going to put most of the time on there. Blood pressure method, how did you obtain it? Everybody's first blood pressure should be with a manual cuff to have a baseline. Then if you want to use an automated cuff after that, that's fine. What the blood pressure is, 120/80. I should go back when we were on blood pressure method. If you have to do it by palpation where you can't hear the bottom number, then it needs to be palpated, and then this will be blocked out. Pulse, what the pulse rate is, the regularity of the pulse rate, the pulse strength, the method of getting the pulse, monitor, was it palpated, cardiac monitor, pulse oximeter, however you did it. Respiratory rate, what the rate number is. The respiratory regularity, respiratory effort, and what the pulse oximetry was, and were they on room air or supplemental oxygen. Entitle CO2, if it's pertinent and you have a way to measure it, the MRX does. None of the other monitors in Madison we have will do that. Capillary refill, whether it's normal, delayed, or absent. Blood sugar level, GCS, motor, cardiac rhythm, if applicable, if you have them on the cardiac monitor. Method of interpretation, if you have them on the monitor. Did you read off what the monitor said, or did you actually manually interpret it, or did you transmit and the doctor told you what it was? EKG type, most of ours are going to be 12 lead left side or 3 lead. Are there any ectopies in your EKG? Lung sounds for left and right. What the monitor rate is, not necessarily what the pulse rate is, but what the electrical rate of the heart is. Stroke scale, whether if you didn't do one, you can just leave this blank, but if you did one, it's good to put what it is, if it's pertinent to your call. Stroke scale type, Cincinnati, there's a bunch of other ones here. If it's other, just make a note in the comments that it's another type. Carbon monoxide, we have no way to test carbon monoxide in this division. Level of consciousness, are they alert or not? Pupil size, on our pen lights there is a way to see about what the pupil size is. If you look on the side, you can see about what the size of the pupil is. Pupil dilatation, is it normal, is it dilated, constricted? Pupil reaction, is it pearl? Does it react to light? Are they blind? Arm movement, left and right. Leg movement, left and right. pain scale on the 0 out of 10 scale, or if you are doing the FACES pain scale for like a child, if you click here, it'll change this to FACES. Again, pain scale type, numeric, and then the FACES. Skin and body. What's their skin color? Is it normal color? Are they cyanotic, pale? You know, if the patient's deceased, are there signs of lividity? Skin temperature. Are they normal? Are they hot? Are they cold? Skin moisture. Excessively dry, normal, diaphoretic, or clammy. Body temperature. How you took it, and when you put it in Fahrenheit, it'll automatically convert it to Celsius. Or if the hospital gives you the temperature in Celsius, if you click Celsius and enter it, it'll automatically go over to Fahrenheit. If you see right there, you can see where it converted 98.2 to 36.8. Invasive blood pressure, we don't have any means of monitoring invasive blood pressure. Score. This would be for your APGAR score for new babies. You just click add and what it is. And that's the end of scores. Next will be intervention.